Good afternoon and welcome to NCBA's webinar on breast cancer, Know Your Risks. Our presenters today are Maddie Troy, and Maddie is a Senior Development Manager with the American Cancer Society. A University of Maryland graduate, Maddie focuses her efforts on the DC Making Strides Against Breast Cancer event and the American Cancer Society's larger efforts in the fight against breast cancer. So Maddie has worked in the nonprofit field since 2016 and has a passion for ensuring that every person has access to quality healthcare. Also, another presenter, Ms. Thelma D. Jones, her work has been fundamental to civic and youth activism and raising awareness of breast health. She is an award-winning community activist, breast cancer survivor, advocate, and founder and board chair of the Thelma D. Jones Breast Cancer Fund. Welcome, Maddie, and thank you so kindly for joining us today.
Thank you, Angela. I am so excited to be here today to share some of this important information with you all. And Thelma, I know, will be jumping on in just a minute. So looks like she's having some trouble logging in, but I will go try to help her with that in a second. So to start, we're just going to kind of go over a wide variety of information about how common breast cancer is, what breast cancer is exactly, causes of breast cancer, some of the risk factors, signs and symptoms of breast cancer, how you can prevent breast cancer and early detection, and then just some more additional information about where you can go to get screened, especially if you do not have insurance or on Medicaid and Medicare. And we'll also end the presentation with a question and answer so that you can ask any questions that you might have. And so you can put those in the chat that's just to the right of this screen. So to start, I do want to say that I'm not a medical professional. And while I do work with the American Cancer Society, we have a lot of people who do have answers to some medical questions you might have. And so feel free to ask those questions, but we might refer you to our website, cancer.org, or to your doctor because we aren't medical professionals. So I will start the presentation with that. Let me pull up my screen. So there is no sure way to prevent breast cancer, unfortunately. But there really are things everyone can do to help reduce your risk of breast cancer. So we're going to go into some of those today and focusing on risk factors that you can change, such as exercise, getting to and staying at a healthy weight, and avoiding alcohol can help reduce everyone's risk. So getting to and staying at a healthy weight, keeping your body weight within the healthy range and avoiding weight gain in your adult life is important because obesity has been linked with a higher risk of breast cancer. Then moving more through regular physical activity is also important. And that is because we have shown that moving more, so that intense physical and moderate physical activity can increase not just your risk of breast cancer, but decrease your risk of all other types of cancers. And then avoiding alcohol is also very important in reducing your risk of breast cancer. So while we understand that it's difficult and that's not something that you can always do, it is shown that 1 to 2 drinks can increase your risk of breast cancer by about 10% over your lifetime. 1 to 2 drinks per day. So avoiding alcohol is another way that you can prevent your breast cancer risk. Something that you can think about, breastfeeding has been shown to decrease your risk of breast cancer later in life, and also not using hormone therapy to deal with the symptoms of menopause. So that is another thing that has been shown to decrease risk. If it's known that your family, you have a family history of breast cancer, or you have the BRCA, the BRCA gene, there are some things you can consider helping to decrease your chance of breast cancer. And so these things are chemo prevention, and that's the use of drugs to reduce the risk of breast cancer over your lifetime. Doing preventative surgery for if you do have high breast cancer risk. So that is also something. So something like a bilateral mastectomy or ovary removal has been shown that it'll help prevent breast cancer if you are at that higher risk. Genetic counseling and testing is also important if you have a family history, because you can then find if you do have the BRCA gene, and that will just give your doctor more information about when you should be getting tested, and if you need to be tested more often than once a year. And so that kind of goes to the final point, which is close observation. And so all of these things are important to talk to your doctor about, because they will know and what risk factors they should be looking at. And this might include going to the doctor more frequently. You might, instead of just getting a mammogram, you might get an MRI, also in conjunction with your mammogram, or start screening at an earlier age. And we'll definitely talk about screening ages, when you should start, when you should stop, and we'll talk about that later in the presentation. Right. So breast cancer early detection. So early detection is so important in helping to fight breast cancer early and hopefully solve any issues that the breast cancers might cause. So when breast cancer is found early and it hasn't spread, it's easier to treat successfully. So, I think Thelma just logged in, so I'll wait for her to get her bearings. But Thelma, we're talking about breast cancer screening right now. So screening is testing to find cancer and other diseases in people who don't have symptoms. So there's different screenings for different types of cancers. But for breast cancer, screening is usually done with a mammogram once a year. And in some cases, it's also done with a breast MRI. And really at the American Cancer Society, we believe that early detection tests for breast cancer can save lives, and that many more lives can be saved every year if women and their healthcare providers take advantage of these tests. So during COVID-19, unfortunately, there was a huge drop in screening rates, and we estimate about 80% of women did not get their mammograms, and about 36,000 cases of breast cancer were not identified in 2020. And that is an incredibly disappointing number, because that's just going to lead, this decrease in screening is really going to cause women in the future to doctors will miss the breast cancer in women's breasts, and that will lead to higher diagnosis rates in the future. So that's why really we encourage everyone to get screened this year. If you haven't already got your screening, schedule your screening with your doctor. So a little bit about mammograms. It's a low dose x-ray of the breast. And for a mammogram, the breast is pressed between two plates to flatten and spread the tissue, and it produces a picture of the breast tissue. And this is something that your doctor will then look at to determine if another test is needed. Sometimes if your breast tissue is too dense, another screening test will be needed. And they also use it to compare previous images of your breast to determine if there's any changes. A breast MRI is not generally recommended as a screening tool just by itself, because even though it's a sensitive test, it still may miss some cancers that mammograms would detect. So that's why we encourage it in conjunction with the mammogram. But another thing to think about is that MRIs are more expensive than mammograms. And so while I wish insurance would cover every single screening test someone needs, it's important to just double check with your insurance before. If your doctor recommends an MRI, you should advocate to your insurance that this is a required procedure. Thelma, I don't know if you want to jump in here. I don't know if you're able to. Most major insurance companies will likely pay for screening tests if a woman is at high risk. So that's just something to remember, that if your insurance is saying that they won't pay for it, make sure that your doctor tells them that you're at high risk. And so now clinical and breast self-exams. So while the American Cancer Society doesn't necessarily recommend regular clinical breast exams as the only way to detect breast cancer, this doesn't mean that breast self-exams should never be done. And so that's something I want to make clear, is that it's not necessarily that the American Cancer Society doesn't encourage self-exams, it's that those self-exams should then be paired with a visit to your doctor every year and a mammogram. So while you know your breasts best, it's definitely important to let your doctor know if you see any changes, especially in situations for people who are at high risk, because while you might be comfortable doing regular self-exams, it's important to then go to your doctor and get a second opinion on if there have been any changes in your breasts. So breast ultrasounds are another way that doctors can use to detect breast cancer. So they use sound waves to make a computer picture of the inside of the breast. And using those pictures, doctors can determine if any lumps look suspicious or different than what was seen on the mammogram. These are important because they can look at women with denser breast tissue. Sometimes mammograms have trouble picking that up. And they can often tell the difference between fluid-filled cysts and solid mass. So cysts are fluid-filled, they're round, and they're usually unlikely to be cancer. Solid masses usually need further testing just to be sure that they're not cancer. Okay, so now I'd like to talk a little bit about when you should start to get your breast cancer screening. So we encourage every woman, regardless of risk, to start getting their mammogram at 45. However, we encourage women at the age of 40 to have the option to begin screening yearly. And that way you just have those tests, especially when you're comparing year over year, any changes in your breast tissue. But the age that we encourage everyone to start is 45. You should start getting your mammogram every year and until you turn 54. And then when you turn 55, we encourage women to get one at least every other year, or continue to get your yearly mammogram if your insurance will allow it. So we definitely are always advocating for younger and younger testing ages. But we understand that a lot of insurance companies won't pay for screening that's done at younger than the age of 45. So that's why I wanted to talk a little about insurance and how you can get your mammogram if you're underinsured or uninsured or on Medicare and Medicaid. So the Affordable Care Act does require private insurers and Medicare to cover the cost of most cancer screening tests. And so unfortunately, if a health plan was already in place before the ACA was passed, you might not be covered. So it's important to check when your plan date was started, because it might not offer that same coverage. But starting at the age of 45, you should be able to get a mammogram every year if you have private insurance or you have Medicare. So even though those plans do cover screening, always double check with your insurance, because the American Cancer Society is not aware of every single plan that is out there. So always just check with your insurance. Medicaid coverage usually varies by state. And so if you are on Medicaid, double check with your insurance state office to determine the coverage that is allowed. So that is all to be said. If you don't have insurance, how do you get a mammogram? If you don't, there may be free or low-cost breast cancer screening programs available in your area. And then oftentimes hospitals and clinics also offer free screening in your area, even if you don't have any insurance. And so to find these, I would encourage everyone who this is applicable to go to our cancer.org website. It's just cancer.org. And if you go to our breast cancer section and screening, there's a link that can take you to a website that will allow you to put your address in, and you can pull up any local breast cancer screening clinics or free programs that can get you your breast yearly mammogram. Right. All right, now going to this slide, this really is specifically for women who are at high risk of breast cancer based on some factors that we already talked about and some more that I'll go into detail later. But certain factors include if you have a lifetime risk of breast cancer, according to the risk assessment tools, which is based mainly on family history. So if you have any family history of breast cancer, you would be considered high risk. If you have had genetic testing done and you know you have the BRCA gene, you would also be considered high risk. And if you had any radiation therapy to the chest when you were between the ages of 10 and 30, that's also considered high risk. For women who are at high risk of breast cancer, we don't recommend a MRI. So for most women at high risk, screening with MRI and mammogram should begin at age 30 and continue as long as you're in good health. But a woman at high risk should make the decision to start with her healthcare providers, taking into account your personal circumstances and your preferences. Like I've said before, if the MRI is used, it should always be in addition to, not instead of, a mammogram. All right, and now I'm going to go into some breast cancer basics because there is some statistics and information that I think would be relevant for everyone here. So to start, breast cancer is the most common cancer in women in the US except for skin cancer. And it's also, I think as of this year, it surpassed lung cancer. So this was updated in 2021, but in 2022, I think lung cancer is now the second leading cause of death in women, and now breast cancer is the first leading cause of death in women. And so while we are seeing decreasing rates of lung cancer, we're seeing increasing rates of breast cancer. And the American Cancer estimates that in 2021, about 43,000 women will die from breast cancer. So this is epidemic in our country, and unfortunately, it is also an epidemic that disproportionately affects Black and not Hispanic women. Breast cancer does occur mainly in women, but men can get it too. So these statistics all do cover breast cancer in women, but it is Men's Breast Cancer Awareness Month. So we wanted to bring little information to any of our men who are listening, because breast cancer does affect men. We all have breast tissue, and that's why it's important that we bring up this topic, just to raise awareness. So men's breast cancer, the lifetime risk of getting breast cancer is about 1 in 833. And the American Cancer Society estimates that about 2,600 new cases of invasive breast cancer will be diagnosed in men in 2021. And so for any men who are on this call, while we don't recommend screening, it's much easier to detect lumps in men's breast tissue. So we recommend self-exams for men. And if you notice any sort of change in your breast tissue, it's important to tell your doctor. And so if you have any other questions about breast cancer in men, we have a lot of information on it on our cancer.org website. It's just cancer.org, and you do /breast, and you can learn more information about men's breast cancer, because men do get breast cancer too, and it's definitely important that you continue to check your breasts for any sort of changes that you might notice. All right. So what you can see from these charts is that our incidence rates and our death rates for about the past 5 years. These statistics are all compiled by the American Cancer Society. What I think is important to point out here is that Black people continue to have an unequally high cancer burden compared to other groups. And so you can see that while white people are diagnosed at a higher rate, Black people are dying at a higher rate from breast cancer. Black people have the highest death rate and shortest survival of any racial and ethnic group in the US for not just breast cancer, but for most cancers. Black women are 41% more likely to die from breast cancer, even though they have a lower risk of being diagnosed. And the American Cancer Society is committed to reducing these disparities. We know that there are systemic racism problems that drive these disparities and that contribute to increased exposure to risk factors and less access to high quality healthcare. And so that's why I'm really glad to be talking to you all today, because we know that the most important way to save more lives from cancer, specifically breast cancer, is to provide interventions like early detection and screening. And so that's why I would encourage you all after this call, go and schedule your mammograms if you haven't already, because it's so important that breast cancer is detected early while we can still treat it. And so what is breast cancer? I know we've been talking a lot about it, and you might not know what it is at all. So any cancer is the growth of abnormal cells, and these cells will invade and damage any normal and healthy tissue you have in the body. In some cases, a single breast tumor can have a combination of multiple parts of the breast, but these are the 3 main types of breast cancer. And the most common are IDC and ILC, and they make up about 70 to 80% of all breast cancer. And this means they're invasive or infiltrating. So the cancer cells have grown out of the ducts and into any nearby breast tissue. And these invasive cancers have the potential to spread out of the breast to lymph nodes and other organs. So the exact cause of breast cancer is not known, unfortunately. There are multiple theories that we have on why breast cancer does happen, though. So some cancer-related DNA mutations can be inherited, which means that you're born with the mutated DNA already in your cells. But most mutations happen after a person is born and are called acquired mutations. So I'm going to go into a little about what inherited gene mutations you could potentially have, and then what acquired gene mutations could potentially happen over your lifetime that could increase your risk of breast cancer. And so any of these factors, if they apply to you, I would definitely encourage you to bring them up to your PCP at your next doctor's visit or your medical professional, because they're definitely things to watch out for, and they might affect how you are getting screened for breast cancer. So gender is the number one. You just have a more likely chance of getting breast cancer if you are a woman. And then getting older is also another risk factor. And these obviously are risk factors you can't change. Most breast cancers, unfortunately, are found in women ages 55 and older. So some genetic risk factors. About 5 to 10% of breast cancer cases are thought to be hereditary, and they're caused by gene changes inherited from a parent. And so women with the BRCA mutation have about a 70% chance of developing breast cancer by the age of 80. And when you do have this mutation, it's often at a younger age that you will get breast cancer than in women who are born without a gene mutation. If you have this BRCA mutation, you also have an increased risk of developing ovarian cancer, as well as some other cancers. And men who inherit one of these gene changes as well also have a higher risk of breast cancer and prostate cancer. In the United States, the BRCA mutation is much more common in Jewish people than in other racial and ethnic groups, but really anyone could potentially have the BRCA gene mutation. And so if you have had any genetic testing done, it's something to look for if you had that mutation. A couple of other risk factors that you can't change are a family history of breast cancer. And so I think having one first-degree relative, either your mother, sister, or your daughter with breast cancer will double your risk of breast cancer. And having two first-degree relatives with breast cancer increases your risk about threefold. So altogether, less than 15% of women with breast cancer have a family member with this disease. However, it's really important to remember that a family history might not go back that far. So you might only know your family history within 1 or 2 generations. And so still something to be aware of, even if you don't have a family history. And if you have a personal history of breast cancer, unfortunately, you also have a higher risk of developing a recurrence or a return of your first cancer. So although this risk is low overall, in the grand scheme of things, it's higher for younger women with breast cancer getting that reoccurrence. Race is another risk factor. So breast cancer risk is slightly higher among white women than African-American women. African-American women are also more likely to die from breast cancer. And Asian, Hispanic, and Native American women actually have a lower risk of developing breast cancer. Dense breast tissue is another high risk factor. So women with denser breast tissue, as seen on a mammogram, have more glandular and fibrous tissue and less fatty tissue. And that increases your risk of breast cancer. And unfortunately, dense breast tissue is also harder to see on mammograms. And so that's why it's important sometimes if you have dense breast tissue to pair that with an MRI. Women after they go through menopause will have slightly less dense breast tissue, which actually is better for mammograms because it's easier to see any potential changes or any potential lumps that might be on the breast. Sorry, I missed that last one. Any breast problems that aren't necessarily cancerous, but still are related to the breast can also potentially increase your risk. Right. And then women with radiation therapy. So this is definitely a high risk factor that you should bring up to your doctor. So if you had treatment for another type of cancer, such as Hodgkin's disease or non-Hodgkin lymphoma, when you were younger, that increases your risk for breast cancer. It definitely varies with your age. So the risk of developing breast cancer appears really to be highest if the radiation was given as a teen or a young adult, when the breasts were still developing. Radiation treatment in older women, so if you're after the age of 40 or 45, it does not seem to increase your breast cancer risk. So really only if you had that chest radiation when you were younger. And then women who have had more menstrual cycles, if you started menstruating before the age of 12, and if you went through menopause at a later age, so after the age of 55, you might have a slightly higher risk of breast cancer. And we think that this is because that this is related to a higher lifetime exposure to estrogen and progesterone. And then DES exposure. So if you were exposed to DES, which is a drug that was given to some pregnant women between the 1940s and the 1970s, you might have a higher risk of breast cancer if your mother took DES during the pregnancy. All right, and now I'm going to move on to some lifestyle-related risk factors. And so I think these are really important because they're risk factors that you can change and that if you can affect to decrease your risk. And so the first one, we talked about this already, but physical activity. So the American Cancer Society encourages everyone to get 150 minutes per week of light to moderate physical activity. And this is just so important, not just for breast cancer, but for all cancers, because it has been proven that physical activity does reduce your risk of certain cancers overall due to its effects on body weight, inflammation, hormones, and energy balance. And this kind of leads right into our next bullet, which is obesity and being overweight. And that also raises your risk of having breast cancer, especially for women after menopause. So having more fat tissue after menopause can increase estrogen levels, and that then increases your risk of developing breast cancer. This also is related to higher insulin, and so being overweight does increase your insulin levels, which also is linked to a higher risk of breast cancer. Alcohol use is clearly linked to an increased risk, like we discussed earlier. So women who have one alcoholic drink a day have about a 7% increase in risk compared with non-drinkers, and women who have about 2 to 3 drinks per day have about a 20% higher risk than non-drinkers. And so that risk obviously goes up with the amount of alcohol one drinks. It's just something to note. Okay, and then having a full-term pregnancy after the age of 30 can put you at a higher risk, and not breastfeeding can also cause a slightly lower risk. So if breastfeeding is continued for 1 year or more, that will reduce your total lifetime menstrual cycles, which then would decrease your risk. So PHT is something that has caused an increased risk, and PHT is used to help relieve symptoms of menopause and to prevent osteoporosis. But it's important to note that it has been shown to cause an increased risk for women who use it over consecutive years. And then some birth controls, like oral contraceptives, have been shown to increase breast cancer risk as well. This risk actually has been shown that after 10 years, your risk returns to normal if you haven't used that birth control within 10 years. So when thinking about any of these drugs, it's important to discuss the risks and benefits with your healthcare team, because definitely something that some of them have more risks and then benefits, some of them have more benefits and risk, and it's important to weigh all of those with a healthcare professional before you decide to make any changes. All right, and then our signs and symptoms. So for those of you who are doing self-exams and trying to discover what might be a sign and a symptom of breast cancer, these are the most common ones. So any of these, if you have a combination of any of these, it's really important to talk to your healthcare provider. And the first one is any new breast lump or mass. So this is the most common symptom of breast cancer. And lumps can be painless, tender, soft, round, and some can even be painful. And so that's why it's important to have any sort of new mass, lump, or change checked by your healthcare professional. Swelling of all or parts of the breast, even if no lump is felt, is another sign. And then skin dimpling. And skin dimpling can sometimes just look like an orange peel. And so if you see that on your breast, get it checked out. swollen lymph node going like nipple retraction, so turning inward, nipple or breast skin that is red, dry, flaking, or thickened, and then nipple discharge other than breast milk. And then the swollen lymph nodes are the last one. So sometimes a breast cancer can spread to lymph nodes under the arm or under the collarbone and cause a lump or swelling there even before the original tumor in the breast is big enough to be felt. So while swollen lymph nodes are not only a sign of breast cancer, it could be one sign. And then just remember that knowing what to look for does not take the place of having regular mammograms and other screening tests. So screening can be helpful to find breast cancer early before any symptoms appear, which is the goal. We want you to find your breast cancer if you do have it early. That way your doctor can start you on a course of treatment that gives you a better chance of a successful outcome. And so Thelma, I'd like to turn it over to you. I know I did most of this already, but Thelma is on here with me and is an incredible resource, and I'd love her to kind of step in and see if she has anything to add.
Thank you so much, Maddie, and good afternoon. And my apologies for the challenge with the lunches here, changing schedule, which is one of the outreach programs that we have with the Thelma D. Jones Breast Cancer Fund. Maddie, you've done such a wonderful job in covering everything. And so maybe if I just shared briefly my story, that could help add some context to what you have said.
Yeah, go ahead.
Okay, and particularly around the importance of early detection save lives. I discovered a lump in September of 2005, but I did not, in September 2006. However, I did not do anything about the lump until March of 2007. And by that time, it had really grown. So I was diagnosed with a late stage 3 HER2 positive, which everyone may know is that's an aggressive form of breast cancer. And I underwent neoadjuvant treatment, meaning I had chemotherapy before I had surgery. And that was to help to shrink all of the large and matted tumors that had developed for not going to the doctor and or paying attention to the signs that Maddie had mentioned in her presentation. And as a result, I had a lumpectomy. I also had 34 lymph nodes, which Maddie mentioned something about the lymph nodes. I had 34 lymph nodes removed because 15 of them were cancerous or didn't clear the margin. And as a result, I developed lymphedema. So lymphedema is this pain and swelling in the arms, in my arm, because lymphedema can occur in other parts of the body as a result of the disruption of my lymphatic system. And then I had radiation treatment for every day for 7 weeks. And then I did 10 years of hormonal therapy. I might mention the breast cancer that I have was considered rare in the sense that in this country, when women develop breast cancer, doctors know the origin or primary source, which is detected in 95% of the women. I was one of the 5% that the origin or source was not detected. And as a result of my breast cancer experience, I've developed a very active organization that I work, the Thelma D. Jones Breast Cancer Fund, that I work very closely with the American Cancer Society on a regular basis. We are very gung-ho about participating in the annual Making Strides Against Breast Cancer and trying to receive, well, let's put it this way. We try to raise enough money so that we can get recognition and be inspired to continue to raise money, because we know that the American Cancer Society does great things in funding things such as mammogram when women cannot afford them. ACS does a lot of research that continues so that we can find a cure for breast cancer. And she mentioned the fact about men. My family, I have a son and a grandson who participated in Real Men Wear Pink. They're great advocates for breast cancer. And we look forward to participating again. As a matter of fact, I want my grandson to join his father this year. You know how they say from a biblical standpoint, if you start a child out early, then normally they won't depart from these things. So I want them to start with my grandson to always have an advocacy spirit with him starting out early. I think that's sort of a brief summary, and then be happy to answer any questions that anyone might have.
Yeah, so I don't know if we can see the questions here, but please put them in the chat if you have any. I don't know, Angie, do you have some for us?
I do, and I want to thank you both first. Thank you, Maddie, for your thoughtful presentation, and then thank you, Thelma, very much for sharing your story. And at this time, we'd like to invite our participants to ask questions. As Maddie said, use the chat to ask questions. And to get us started, I have a few questions here that I'd like to just ask for myself. And the first is, given when it comes to breast health, and given where we are as a country moving towards everything green and natural, does the American Cancer Society offer any guidance on deodorant and which types of deodorants women should use, especially when we're speaking to lymph nodes and so forth?
Angie, that is actually a very good question. And I am not sure of the answer, but I will look into it and find out for you. I will also just, as a side note, share these slides with everyone because I know it was a lot of information. So I know I need to see it sometimes and read it a couple times. So I'll send those slides, and I'll also find out that information, that question.
Okay, thank you. And then my second question is there a correlation between smoking and breast cancer?
So there has not been a specific correlation found between smoking and breast cancer. It's really smoking and lung cancer, obviously. But certain cancers can then increase your risk of other cancers. And so I'm not sure exactly if a specific correlation has been found, because I don't want to speak incorrectly, but having cancer, any sort of cancer, then increases your risk of other cancers. So that is definitely something to be aware of.
Okay, and since we are waiting for questions to come in the chat, I have just 2 more questions I'd like to ask, and probably 3, but nonetheless, wanted to know if private insurance, Medicare and Medicaid, do they cover the genetic testing that you spoke to? And if it's okay, do you mind fleshing out that test? What does that test mean, and what does it cover? And if I present it to my doctor, would he readily write a script for me to get that genetic testing?
Yeah, so genetic testing usually involves a blood draw that they can then take and determine all sorts of things. I would check with your insurance company about if it is covered, but if you have a family history, it's definitely something that should be covered, because trying to find out if you have that BRCA gene is important in determining any potential increased risk in the future.
Okay, and then to piggyback off of that, what if I don't know my family history and my ancestors have predeceased me and I just don't know my family history? Am I now the history for my family moving forward with my mammograms and so forth?
Yeah, that's a good question and a good point. And I think Thelma's had someone on her calls last month who she said that exact same thing. She said, I didn't know my family history, and now I am that family history because I am the first one with breast cancer. And it's such a good point that, especially even now, screening is so high tech, but that's a new development. So some of our family members might have had it and we didn't even know about it. So yeah, well, that is just one risk factor. Not knowing it, obviously, if you don't know it, there's nothing you can do about that, unfortunately.
Okay. And then,
even if I can add to that, that is also because I agree with what Maddie is saying, and that's why it is important for us as individuals to know our bodies, because absent of access to our family history, unless we really dig into genealogy aspect, and when we think about only about 5 to 10% of breast cancer is hereditary, knowing our bodies, being mindful of the risk factors that Maddie went over in the presentation, that we cannot prevent, such as the fact that we are a woman, our gender, growing older. But then to look at things like we can do our regular mammograms. We can also be mindful of any signs or symptoms. We can reduce any alcohol consumption, or if we don't drink, now is not a good time to start. So, and then be mindful of things like if, as Maddie said, if we had radiation early in our lives, we want to make sure that we tell our doctors these things so that as they are reviewing our individual history, they will be mindful of these various things, of the risk factors that we have, and we should be mindful of the risk factors that we can help to reduce.
Okay. And Thelma, that is a great segue. We've got a question here, and I want to add something to this question. Something you said resonated with me about speaking with our doctors. Is it also important to speak with our doctors about our environment, where we might be living? If there's construction, if we, God forbid, some of us live in parts of our country where the water is an issue. Are those risk factors or possible factors that we should share with our doctor about our environment? That is part one to that question. And then two, someone has asked Thelma if you might give us some tips on how to go through healing from breast cancer. Did you have a caregiver? Did you need any emotional support during your treatment? And if so, if it's not too personal, might you share that with us?
Absolutely. So on the first part about environmental factors, our environment, the air we breathe, the water we drink are things that impact our health. I live here in Southwest where we have a lot of chemical plants, and we have a high preponderance of cancer, including breast cancer, which was one of the reasons that motivated me to create my breast cancer support group, which originally for several years was an American Cancer Society breast cancer support group. So when I mentioned that ACS and I work closely together, we have a long history. And yes, we should. It's important that we tell our doctors about any environmental hazards in our neighborhood, and particularly because we are living in a transit society. So you may have been born and raised in an area where there were toxic chemicals, but now at a much later stage, you're here in Washington or some other jurisdiction. You want to try and remember to share these kinds of things because just when I think about it in our news, many of these toxic or chemical waste sites have had results about cancer showing up in different areas, and not just one person, but a group of people. So, and I hope that helps. In terms of the support group, having a good support group when you go through breast cancer or any kind of cancer or chronic illness is important because it changes your life drastically. And to be able to rely on someone else to accompany you to your medical appointments, particularly when you're newly diagnosed, there is so much that's going on that it's important to have someone there with you to help take notes because you are just not going to hear and remember everything that the doctor says. Now, we are very fortunate to have a person who's going through breast cancer, any kind of cancer, is fortunate to have a good support system. However, there are people in my support group that I know had to travel the journey alone. And just like with the American Cancer Society, our support group believes that no one should travel their journey alone. And whenever you're experiencing something challenging, depending on where you are mentally, whether you're a negative or positive type person, and if you're alone too much, you might start thinking the worst, that I'm going to die, or no one's going to love me, or I'll never find the man or the partner that I want, because with breast cancer, we go through a lot of body changes. Our body images change, and that could affect things in relationships. So having a shoulder to lean on and someone to talk to, because sometimes others will help us to change from that negative thinking. And because so many developments have been made in breast cancer is no longer considered a death sentence. And when I mentioned about how excited we are in annually participating in the American Cancer Society, making strides against breast cancer, some of the funds raised go for research purposes toward fighting breast cancer and finding a cure.
Elma, I thank you for that. I wrote a note to myself that breast cancer is no longer a death sentence. And so I thank you for saying that. I thank you for sharing your journey. I wish you continued success, and thank you for what you're doing to educate women, African-American women and men about breast cancer and how to become advocates for themselves. And as I look at the clock, we have just a few more moments. But I also want, in addition to inviting our audience to use the chat to ask a question in our remaining minutes, I simply want to also ask you, is there an opportunity for those that might be interested in participating? How do you get involved in clinical trials? Is that?
So,
Okay.
yeah. So this is a good question. Well, first I'd like to just bounce off of something something Thelma was saying, because it is so important to have a support group or have someone who can listen. And so the American Cancer Society does have a 24/7 hotline with trained volunteers who you can call at any time if you have any questions about if you have been diagnosed or if you have a family member or friend who's been diagnosed, because just sometimes having information can make the whole process a lot less scary. And so they are trained medical professionals who can answer any questions you have, and I'll put the link in the chat for them.
And is that helpline multilingual, and is it also too for the deaf?
We have Spanish speakers. I do not know about for those who are hard of hearing or deaf, but I will find out.
Okay.
We do, though, have a program called Reach to Recovery. And I think this is a really great volunteer opportunity or for those who are a survivor of breast cancer, because it's a program that connects survivors to those who've been newly diagnosed. And you can communicate with video calls, text, any of that stuff. But it really just is a person who can be there with you on your journey. And so I'll also put the link in that. But if you go to our website, it's called Reach to Recovery. And that is a great resource because we understand that it's so hard when you hear those words, you have cancer, and there's a lot of questions. And so having someone who's gone through it and can be with you is really helpful.
Okay. And I thank you for that. I think we'll have to delve into clinical trials maybe on with our next conversation. But just wanted to ask you before we close out, are the rideshare companies partnering now with the American Cancer Society? So if someone needed treatment, they would be able to use a rideshare company to do so?
That is a good question. I will say we have a program called Road to Recovery, which is not Reach to Recovery, but Road to Recovery, that is just starting back up after COVID. And so it's not in every community, but if you sign up, you can find out if it is in your community now or if it will be by the end of this year. And it's volunteers who will drive people who need rides to chemotherapy or doctor's visits, completely free.
Okay. Well, thank you. That's wonderful to know. Looks like we have a minute left, and I'd like to extend the invitation to our audience to ask any questions in our remaining minutes. And thank you very much, Maddie, for posting those resources. Very much. And thank you. And thank you. I think we lost Thelma there, but thank you to Thelma for all that you do to remind us that breast cancer is no longer a death sentence. So we, on behalf of NCBA, thank you so very much for joining us this afternoon. And it looks like we don't have any questions. So I'm going to give you back a minute of your day and thank our audience very much for joining us. And again, thank you, Maddie, and many thanks to Thelma.
Thank you. It was a pleasure.
It was my pleasure. Have a great day, all.
Thank you all. Have a great day.
Thank you. Thanks. Bye-bye.
Bye-bye.